Hello, and welcome to an overview of communicating with compassion. My name is Melissa Cottle. I'm a clinical assistant professor in the Department of Community and Public Health at Idaho State University. Upon completion of this unit, you will be able to understand the definitions of communication and compassion, identify the basic principles of face-to-face communication to support patient relations, develop high-quality listening, attending, and responding skills. Review barriers to communication. Recognize methods for cross-cultural communication in clinic encounters. And apply and practice communication skills as used with a patient. Communication is defined as the exchange of thoughts, messages, or information by speech, signals, writing, or behavior. Compassion is a deeply held belief that we are all connected to one another. It can be described as the feeling that arises when you are confronted with another's suffering and feel motivated to relieve that suffering. Compassionate communication, then, is the ability to exchange thoughts while understanding and empathizing with another's pain, anxiety, or suffering. Compassionate communication is a skill that can be learned and strengthened. Communication is a system, and effective communication is the key to productive relationships. This holds true in both our personal and professional lives. Communication can be described as verbal or nonverbal. Verbal language is defined as a series of expressive thoughts and perceptions described through words, symbols. It is direct. Verbal language is divided into two components, encoding and decoding. Encoding occurs when a speaker frames thoughts or ideas into words. Decoding occurs when those words are dissected, analyzed, and interpreted by the listener. Nonverbal communication is any communication that does not involve words. Nonverbal communication comprises more than 70% of all communication. This may include body language, facial expressions, touch, and even tattoos or style of clothing. It is indirect and often unconscious. Elements of nonverbal communication can be categorized as physical or non-physical. Nonverbal physical elements include touch, such as a handshake or a hug. Emblems and illustrators, such as a thumbs up sign or waving your hand by your face to show that you are hot. Affect displays, known as facial expressions. Regulators, such as eye movements or shifting your weight from one foot to the other to manipulate or regulate a conversation. Adapters, known as body language. And paralanguage, including the elements of speech such as pitch, volume, tone, and rate. Nonverbal, non-physical elements include territorial space, such as personal space, and appearance, such as clothing, which can provide clues about a person's background or personality. When a discrepancy between verbal and nonverbal communication occurs, research indicates the listener will be more likely to believe the nonverbal cues. That is why it is important to practice the 6 C's of good communication. The 6 C's of good communication are: number 1, clear. Ensure your thoughts and ideas are clear before communicating. Speak with precision and directness. Number 2, concise. Avoid information overload. The amount of information a person can receive and process in a single session is limited. Keep your message brief and focused. Number 3, correct. Use language appropriate for your listening audience. Remember, meanings of words can vary. Number 4, complete. Check for understanding from your listener. Validate or confirm assumptions. Number 5, courteous. Ensure the timing of your communication is good. Be mindful of your nonverbal cues and remain free of judgment. And number 6, concrete. Convey the facts in a caring manner. One way to ensure that communication is clear, complete, and correct is by asking questions. Here are some examples. Can you be more specific? Can you give me an example of that? What happened then? How does this affect you? Can you fill me in on the details? Practice asking these questions in your daily communication. Effective communication utilizes both verbal and nonverbal communication. It also requires developing high-quality listening, attending, and responding skills. Hearing is the reception of auditory sensations, while listening is the understanding of those sounds. Dr. Brian Luke Seward lays out 9 best practices for high-quality listening, attending, and responding. Number 1, assume the role of the listener. A study published in the Journal of General Internal Medicine reported that doctors spend approximately 11 seconds listening before they interrupt a patient. Be an active listener. All attention must be paid to the speaker. Listen to understand. Clear your mind of other thoughts and don't prepare comments while speaking. Refrain from reading a chart or taking complex notes while a person is speaking. Number 2, maintain natural, comfortable, culturally appropriate eye contact. Number 3, avoid word prejudice. Some words can elicit emotional responses. Be aware of those words and prepare to be objective. Number 4, use minimal encouragers to indicate you are understanding. This includes nodding and short word questions such as uh-huh or oh. Number 5, paraphrase what was said to ensure understanding. Translate into your own words what the speaker said. Number 6, ask questions to improve clarity of statements. This can help open the conversation further. Number 7, use empathy to reflect and share feelings. Pay close attention to the speaker's feelings as well as thoughts. When the speaker is expressing feelings, convey empathy and encourage them to continue. Reflect the feeling with statements such as, "It sounds like you're feeling frustrated with this issue." Number 8, provide constructive feedback. And number 9, summarize the content of what was said. Synthesize the speaker's thoughts and feelings into an integrated understanding. Communication difficulties can arise for a variety of reasons, including lack of high-quality listening and understanding, incomplete knowledge or information, not clearly explaining priorities and goals, making assumptions or allowing emotions to block the communication process, a lack of trust, misunderstanding cross-cultural differences, including language, conversation styles, and interpretation of words, differences in class, socioeconomic status, sex, race, or sexual orientation, limited health literacy, implicit bias or implicit stereotype, or structural racism. Outcomes of poor or ineffective communication can include poor care coordination and medical mistakes. More than 70% of malpractice lawsuits are due to errors in communication. Poor patient cooperation or adherence, misunderstandings, frustration, anger, or conflict, low morale, or high employee turnover. You can begin to prevent or overcome the barriers to effective communication through using the 6 C's of good communication and practicing high-quality listening, attending, and responding. Recognizing methods for cross-cultural communication in clinic encounters. Culture can be defined as a system of shared beliefs, values, customs, behaviors, and artifacts that the members of a society use to interact with one another and their world. Cultural competence is the ability to work within a specific culture or co-culture. This requires compassionate communication and can include seeking knowledge about and understanding of the community, their non-biomedical views of health and wellness, and the challenges they may face. Taking time to build trust. Providing access to interpreters. Providing multilingual patient education materials. Screening for health literacy. Identifying local resources for referral. Utilizing shared decision-making. And working to address structural racism and implicit bias and improving outcomes for all. In conclusion, compassionate communication includes high-quality listening and the use of good verbal and nonverbal practices. Compassionate communication can help healthcare professionals develop strong relationships with their patients and result in improved outcomes. Thank you.